we've looked at preoperative assessment, we've looked at the surgical technique, and in my hands, I'd maxed all of this out, and still I was getting failures. And still at the end of the operation, I wasn't happy. And I knew that the biology was missing from this whole um, a la carte approach I had for these tendons, and what else was needed. And that's when Tetrous came around. So for me, this was really interesting technology. I will not show the Tetrous video because Nick's just shown that. But I, use the implant. It doesn't even add more than 5 minutes to the case. You can use it in osteoporotic bone to supplant the anchors, or just put it in between in the footprint. So what we tried to do is we tried to look at the 31 patients now in which we have used the demineralized bone fiber group and compare this to a group of patients who had a muscle advancement procedure with smaller cuff tears as well. So muscle advancement and smaller cuff tear, so that we could have a really heterogeneous cohort and look at if actually the biological implant and the biological augmentation was making a difference. So for the purpose of this study, I started using Tetrous with really large tears, which were essentially all of supraspinatus and infraspinatus tears. They had pate 2 to 3 retraction with low grade of fatty infiltration. So these were the big muscle slide cohorts to start with. And our results were very encouraging. So without the augmentation, you can see the patient on the right. The cuff is still healed, but the quality of the tendon looks a bit sus. The patient's functionally doing quite well and the strength's good, but just that MRI is not as happy looking as the one on the left. You can see with the Tetrous implant, much nicer, thicker enthesis, footprint coverage is excellent, and the head's really nicely centered as well. So we did see with this that the mean tendon thickness has grown by around 0.5%, 4 mils or 5 mils, which is significant at that point. If we look at the range of motion and forward flexion, the Tetrous patients are doing as well as the other, if not better. These are still 6-month data, so I think in time this will show things better. But we had a big hunch that the Tetrous patients are outperforming my non-augmented patients at every time point from 6 months to 12 months and even at 3 months, which we are collecting data now. The strength measure is still equivocal right now because my rehab is very conservative for rotator cuff repair for strength in the first 6 months. So the strength for the supra and infra is equivocal right now. But since I've been using this in the last 6 months and I've seen this data, I've actually started an accelerated rehab protocol now in patients who've had the implant. So one of the things which we wanted to study was, does this actually, the thicker, more robust tendon, mean earlier recovery, mean faster rehab, mean earlier return to work? And our provisional data does show that the pain relief is better. The ASCS scores at 6 months with the Tetrous group, which is the blue, is equivalent to 12 months with the non-augmentation group. So we compared the 6 to 12-month data between the augmentation and the non-augmentation group. If you look at the constant score as well, which is a good measure of functional outcome and strength, we're achieving strength at 6 months, which I was achieving at 12 months. So I've actually started counseling my patients now that they're going to get back their full strength and function at 6 months, which they were getting at 12 months, which in everybody's game is a game changer. The UCLA is better. And even as I mentioned, the strength doesn't show that data right now, and that's probably because of our rehab protocol. So to summarize, despite using muscle slide and advancement for these massive rotator cuff tears, this is a very viable technique which eliminates the need for an SCR or tendon transfers in the vast majority of patients. And this, in conjunction with demineralized bone fiber implant, leads to an excellent enthesis formation, and the results at the 6-month mark are very, very promising. We've submitted the original results for publication, which is going through a peer review process, and we should hear, any week. But we do need at least a 1-year follow-up on all the patients in the future. But the early results are extremely promising. Thank you all.
All right.